So this is kind of just a mini podcast about knowing what you're getting. And I think with hair, this is kind of a big deal, knowing what you're getting. A lot of our patients, they've done research on hair, they want to know more about hair, and they don't know exactly what they're going to get. And so what we aim to do is deliver on what we talked about, sounds like an easy proposition. So for most hair cases, depending on where you go, especially if you go to more of a chain situations with billboards and change and all this, you may meet a doctor, you may not meet a doctor, the doctor may be involved in your case, may not be involved in your case. And they may be involved to a very limited degree. For me, I don't know if I'd want that experience as a patient. I definitely would want someone really involved in the planning, the execution, that component of it. And so for our practice, we involve two physicians, that's two, me and Dr. Samia. And the reason we do that is I think hair is so involved, you need two people involved with this. I do most of the hairline drawing except for eyebrows. I do a lot of the hair harvesting component, and Dr. Samia does a lot of the site creation, the site making. We kind of go back and forth, but that's really her forte. But we go back, we're interchangeable on almost everything, except for the FUT, the hair harvesting component, where I'm almost strictly doing that because I'm really particular about my scars. So caring about what you do. Again, my biggest thing about going to a chain, not that they don't do good work, but I don't know, I can't answer that question, is that you don't know if they actually care. They're going to put a lot of money towards marketing, a lot of money towards, making that person feel like they're getting this or that. But for us, I don't know if we really put any money towards marketing, especially marketing towards hair. And that component of it is it's rather it's a word of mouth, but we definitely care what we're doing. You're going to meet me, you're going to meet my wife, Dr. Samia, you're going to meet our team, and it's important to know that we're the ones who are going to be taking care of you. It's not going to be just random people who are hired behind this elaborate marketing team, whatever system or chain you're using. So I think that's important to know what you're getting. We like the Artis IX, and the reason we like the Artis IX is because there is, for the patient, besides just a better result overall, there is some accountability for us. You can actually see the numbers of harvested hairs, what's going on. So it's a much more objective experience. Sometimes you go to these places and they say, we're going to cut your hairs, make more hairs. That's not really making more hairs. You're splitting my grafts. You're actually ripping me off. So why have that? What we want to know is how many grafts were harvested, how many numbers were grafted. So we have all that kind of measured and determined, and so that patients can get theoretically, actually in actuality, the best results possible, and not really understanding, well, what did I get today?